You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. I am super excited to welcome Dr. Jill Carnahan, functional medicine expert, back to the podcast. Dr. Jill is a dual board certified medical doctor and the founder and director of Flatiron Functional Medicine outside of Boulder, Colorado. She specializes in searching for the underlying causes of illness through cutting-edge lab testing and personalized medicine protocols. Dr. Jill has her own healing stories from breast cancer, then Crohn's disease, and then debilitating mold toxicity. And what I love about Dr. Jill is that she represents a beautiful balance of science and data and compassion and intuition. In our last interview, which is episode 11, I interviewed Dr. Jill about her best-selling book, Unexpected. It's part autobiography, her healing stories, and prescriptive wisdom from her many years as both a patient and practitioner. And speaking of which, she is also the executive producer, film writer, and featured in a new award-winning documentary about her journey overcoming illness called Dr. Patient, which you can find on Amazon Prime and YouTube, among other places. And this time, I've asked Dr. Jill back to talk about all things mold. It's something she's personally experienced, I've personally experienced, and something we are seeing more and more of in my own functional natural medicine practice. It's something that needs to be discussed openly because if it's ignored, it can be the foe that takes you down or keeps you down if you're trying to heal from complex chronic autoimmune challenges. So welcome, Dr. Jill. It's not a moment too soon.
Thank you, Palmer. Always excited to be here with you.
Oh, I am so glad. And like you, I always love starting with story, and you've got a lot of great stories to share. But in this particular case, can you talk about your feeling, your journey through mold and the whole adventure of mold illness?
Sure. So as listeners might know from my previous thing, in my 20s in med school, I went through breast cancer, aggressive, and then Crohn's, and really had healed. So I dealt with autoimmune and cancer, and you name it, I've collected these diseases and was really doing pretty well in my 30s. I had moved in 2010 from Illinois, where I grew up, and did a residency to Boulder, Colorado, and was running. In fact, I had just competed in a 5K and done really well, competitive time, and all this wonderful things were happening. And then slowly over the next year or so, I started having more shortness of breath. I started having rashes, skin irritations, immune issues where I keep getting infections like colds and flus over and over again. My energy level dropped really low, and even cognition, where I could still do complex cases, but I would forget names of patients that I'd seen, 4 weeks ago or something like that. So I knew that something wasn't quite right, but I didn't know what it was. And I also knew that something in the environment could be contributing. But it's so funny. I have such compassion for those who have mold-related illness, because there's often a sense of denial in the beginning, because if it is mold, it's going to affect your life either financially, or you might need to move, or there's something about mold that's much deeper than just the physical effects. It's a psychological trauma, really. And we can talk about that too, because there's actually real evidence of how mold affects the HPA axis. But unbeknownst to me, this was mold, and I was just living in this exposure and not really knowing it. Finally, though, it got bad enough so that I did a couple of things. I did a urinary mycotoxin test, which tested my own body for excretion of mold and mycotoxins. Now, I want to say, and we'll talk more about this as well, that's not the end all be all. And I think a lot of people out on social media are like, oh my gosh, I got a positive mycotoxin test. I want to just be very clear. That is not a diagnosis. There's so much more to it. And there's so many other reasons besides just an exposure where you could be excreting mycotoxins. So you need other data. So I did the same thing as get more data. And I did a mold inspection in my office. That was where I had suspicion. In 2013, the year before I was having these bad symptoms, our town of Boulder, Colorado had thousand-year flood, they called it, just literally almost $1 billion of damage. It was so devastating to the community, and so many homes were underwater, and my office had water damage as well. Now, looking back, I think there was probably a little bit of a mold issue. My actual office was on the second floor, right over an unfinished crawl space. So there was a water standing under my office before the flood. And then one level down was a basement, which actually had mold growing when we checked it out. And we found that mold as we tested it was Stachybotrys, the worst of the worst, black mold. Now I remember it's so funny with the mold inspector. I'm literally going around, walking around with him, and like I'm putting my nose right up to this black spot that ended up being Stachybotrys. No mask, no protective gear. And again, now my inspectors, I use some really good quality people. I would never do that. But back then, that just shows how little I knew about the toxicity. But when I found the bulk sample matched the type of toxin in my urine, I knew that I had come across something really important. And again, I knew a little bit about mold, but in medical school, we're taught it's an allergen. This is the adaptive immune system, not the innate immune system. And the truth is that mold has a massive toxic effect on all systems, including the both innate and adaptive immune system. So just like in COVID, when we learned all the cytokine storm, and that cytokine immune response was often responsible for people getting really, really sick. So the virus would trigger the cytokine response. Um, Same thing with mold. That mold in certain people genetically can trigger this cytokine response in the body. That's like a vicious cycle, and that's what really causes the damage. So all that to say, 2014, I found out I had massive mold in my office and it was affecting my health. And when I found the results that came back positive for the mold in my basement, I literally remember it was the day after Christmas, the 26th of December. I never again set foot in that office. So interestingly, what happened was I had found that, and then I started realizing the porous material. So one thing that was, I talk a lot about my story that was really devastating. I had all of my 20 years of medical school textbooks and books, and I loved books. And I kind of joke because before I went to medical school, I thought I was going to be a librarian because I loved books so much. Like that was what my life goal was, to be a librarian. Right? I just love books so much. So it was devastating to realize the amount of the toxicity in my office, and then also the fact that maybe I could have figured out a way to save or keep or whatever. But at that point, and I say this out loud to your listeners because it's so important to realize what really matters. And if you have to get rid of books or mattresses or certain things in your house that keep you healthy, it is so worth the cost. And it was worth it. I don't have any regrets, but I literally walked away from my office, my furniture, my books, everything in that office, and I started over. My whole medical practice, I literally started over with just my brain and my patient information charts, and that was that. And it was the best decision I ever did because I really came from this toxic environment and started fresh in a new place.
What a story. And I am immediately thinking about be very pleased with sometimes like this. So, for whatever reason, thing. But now you have this profound wisdom that you can help others into the healing because you don't create something.
Yeah, and that's exactly right. And like you and me both share this, these experiences that we go through are our greatest teachers. And this was no different because I would have never chosen to be the mold expert because it's complex. It's probably the most complex area of medicine. But in that experience, I realized number one, I had to get well. So I had a massive motive to save my own life and figure this out. And I went deep and looked into the research and figured out how to get well. And then what's happened since then, almost a decade later, is my ability to be able to help so many more people who've had mold related illness because I had to really figure it out to save my own life.
Well, we're going to dig into the how to in terms of detoxing from mold and what to do and so forth. But I think before we dive into that, it might be helpful to people who are thinking to themselves, well, what's the big deal about mold? I mean, mold is everywhere, right? I mean, it's trying to take over the planet and us, and it will eventually. So mold is everywhere, but what distinguishes and maybe talk about the difference between mold, mold spores, and mycotoxins so that we have a sense of what we're really talking about.
Yeah, great question because it is. In fact, I just taught, I mean, there's all kinds of you like, well, that can't be a big deal. My grandma had mold in the shower, or these kinds of naysayers. Or someone just the other day said, oh, that must be a disease of the affluent. And it's not, it's indiscriminate. I mean, some of the inner city housing places, some of the military housing are the worst problems with mold. So this is everywhere. Now, I will say that, a small hut in Africa that's made of earth and there's lots of airflow is actually going to fare much better than a LEED certified building in New York City because the more efficient we have with our buildings and the lack of exchange from outdoor to indoor air, which is in these more and more efficient buildings where we're trying to conserve energy, all beautiful things. And then we throw on top of the house the solar panels, which increase EMFs, which can actually aggravate the mold. And I am all for energy efficiency and environmentalism. I love that. But we have to think about both sides of the coin, because the things that we're doing to our environment, whether it's increasing EMFs in a home or whether it's making it so airtight that we can't exchange air, those are the reasons. So if you're outside, there's mold everywhere. There's dirty, leaves that are composting in the ground, or I see people in forests that have sinuses issues from that moldy, wet leaf stuff, or I mean, you name it. But the difference is this: dilution is the solution to pollution, which is meaning if we're outdoors, there's so much air that dilutes that effect that it's not concentrated. But if I have mold behind this wall next to me, all of a sudden and say I have my windows closed and the air is just circulating internally, my attic sealed, my crawl space is sealed. I have a box here, we call it building envelope, that has a certain amount of airflow that's just being exchanged, and whatever toxin is in there, from benzene off-gassing from my stove to mold creating mycotoxins. These are small particulate, 1.0 or 2.5, very, very tiny, and they just exist in this environment, and the concentration is high enough to create symptoms in individuals who are sensitive. Not only that, but in the 70s, we created paints that had fungicides in them to prevent mold growth, right? Like, oh, let's do this great thing. And just like antibiotics in cattle or pigs are creating more resistance, what we did is inadvertently create mold resistance by putting these fungicides. All the weeks, common, not super toxic molds would die off and never grow on that paint. And we created super molds, and some of the real toxic molds could resist this and now grow indoors. So a lot of times the indoor molds we see today versus 50 or 100 years ago are much more toxic, like Stachybotrys chaetomium. And then they're producing those mycotoxins. And back, just so your listeners understand, to the size of these particles. So we have spores are going to be pretty large. If you inhale those, they're never going to go past your large airways. They probably won't get into your immune system or ever even bother you unless it's an allergic response to a mold spore. But the mold behind the wall produces something called mycotoxins. This is a protection from that organism. And there's many of these. We can even test these. These are what we test in the urine. We can now test them in the environment. Things like Chitomoglobosum or rhodin or trichosathines, which is a whole category, a T2 really toxic mycotoxins from the most toxic molds. And what happens with these are smaller than viral particles, at least either 1.0 or 2.5. So when we inhale a mycotoxin, say this wall behind there's the spores, they're contained. But that mold is excreting mycotoxins. It goes right through the wall. It's so small, it can penetrate almost any material. And then we breathe it in, and within seconds of inhaling that'll go into our alveoli, and the alveoli has no diffusion capacity to protect us because these are so small. They go directly into our bloodstream. And this is why someone who's mold sensitive like me can go into a hotel or a building and literally within seconds notice symptoms because they're inhaling those a nanoparticulate into the alveoli, into the bloodstream. And literally you could have mycotoxins in your blood within seconds because there's no barrier that will protect from that smaller particle. So it's kind of a big deal to understand the mycotoxins are what the problem is. And it's also interesting because when we talk about remediation and fixing the problem, a lot of times you'll have a great remediation company that goes and tears down this wall and takes out all the particulate that was in there and kills the mold and takes out all the material that was affected and does it under containment. But then they take that down, and then all of that mold was excreting mycotoxins for the hours, days, months, years before the remediation. And I think of it like if you had a campfire in your house and you put out the fire quickly and you remediate the damage, that smoke had been off-gassing from the fire and damaging your curtains and your books and that. So even if you fix the fire, fix the floor that got burnt and take away all that debris, you're still going to have smoke damage in your house. And that's a very good way to think about this with mycotoxins. So often after the remediation, the biggest thing that helps people is doing a fog and a very small particulate clean is what we call it, because that will get rid of that dust level of the mycotoxins, and dust is what carries these toxins. So the best remedy post-remediation or prevention of mold is creating a clean, dust-free environment to the extent that you're able.
I love that. That is so great. I don't hear enough about the small particulate cleaning and dry fog I was going to get into with you. So we'll definitely get into it. It's also helpful for people to know that mycotoxins are not alive. It's actually a toxic byproduct, right? But it's not living. But my understanding is that even dead mold spores can produce mycotoxins. Is that why cleaning, a thorough remediation is still important, even if the water damage, the leak is fixed, let's say, but there's been an area where mold was produced, and let's say you've killed the mold or the mold is dead or dry. Is it still off gassing or producing these mycotoxins, is what I'm trying to say.
Ooh, I love talking to you because you get to these nitty-gritty details that really matter in patients getting well. So let me explain.
Mhm.
So the mold spores, as long as they're living, they're throwing out mycotoxins, and that is like the smoke from the fire getting in your books and your mattresses and your porous materials, in particular paper and clothing, although that can be cleaned. And then anything porous can hold on to these mycotoxins. Then once you go to that wall and you kill the mold and you take care of the spores or whatever, that spore can break up. I think someone once told me it's almost like a dried flower arrangement. If you blew on it or flicked it and it just shattered into a million pieces because it's so friable and dried, that mold spore could do that. And those fragments of the spore could still cause immune activation, even though they're dead.
Mm.
Now, the dead mold spores can't produce mycotoxins, but all the time they were living, they were contaminating your environment with mycotoxins. So those are there. And what you said is so important because I get questions all the time on social media or anywhere when I speak, and people will say, well, how do you kill mycotoxins? And what you said is so important. It's almost like, how would you kill gasoline or how would you kill formaldehyde? You don't kill a toxic chemical. So I love that you clarified that. You can't kill mycotoxins. You have to eliminate them, clean them, and remove them. You can't kill them. And they actually did studies to say, how could we actually destroy mycotoxins? They did up to 500 degrees Fahrenheit and barely touched the mycotoxins. And then they did like gamma radiation, which is in the spectrum, like all, ultrasound and X-rays and CT, whatever. It's a very, very high radiation. And even with those two extreme conditions, they could barely kill. So for example, say you buy coffee and you don't test or get clean coffee. Coffee and chocolate, unfortunately, are common sources of mold and mycotoxins. You might, say, oh, well, I put in the hot boiling water, it'll kill the mold. That's true. You might. But the mycotoxins, if that coffee had mold on it and was producing mycotoxins, mycotoxins are not going to be killed in the boiling water. They're not going to be killed. And that's why, again, in food products and things, if there's mycotoxins that are in there, there's really no way to kill them. So we have to make sure we're having clean food that's mostly mold free. And in our houses, after we do that remediation stuff, we can kill the mold, but we must remove and clean to get rid of the mycotoxins because the honest truth is the mold itself is allergenic and harmful, but it is the mycotoxins that are nephrotoxic and neurotoxic and cause dementia and cause neurodegeneration and cause immune deficiencies. It's really those toxins that we have to deal with. And
So
autoimmune.
beautifully.
Sorry.
And autoimmune. So this is it. We are seeing this more and more in my practice with clients who are dealing with, it could be mysterious symptoms. And that's the next thing that I want to get into is how would somebody know that they're even dealing with this? Because you described beautifully that there are some people that are allergic, maybe the canaries who walk into a hotel room that immediately have a reaction. And maybe the rest of us who, have a slower filling bucket
Mhm.
and it produces, it's toxic to the nerves in the body. And so with an MS diagnosis, is the numbness and tingling and all of the neuropathy, it could be from mold, also mold toxicity. So I think it's super helpful for people to have a pathway into understanding if they're dealing with mold in the first place. It's my understanding one of the most immunosuppressive, what do we even call it?
Yeah.
Toxins known to man. And so if people are dealing with an autoimmune disorder and they're living in a moldy place, that it's nearly impossible to heal. So I know I've just thrown a whole bunch of things because my brain is kind of flitting around with all of this, but anywhere that you want to take that. And the next thing that I want to talk about are common symptoms.
You
So
got it.
anywhere you want to address this
Okay.
conundrum between canary with an allergy versus somebody who's having this fill up their toxin bucket.
Okay, this is great. So first thing is, let's frame this in. One of my favorite topics is, of course, environmental toxicity, and that's this big bucket of all the things, including mold. And let's just frame that quickly, and then we'll go down and dive and answer all your questions. First thing is we have exotoxins and endotoxins. Exotoxins are mold, heavy metals, parabens, phthalates, PCBs, polyfluorinated compounds like Teflon and Gore-Tex, which are forever chemicals. And I could go on and on. Hydrocarbons from grilling or charbroiling things. All of these things externally can affect us. We can inhale them. We can have them on our skin. We can have them in our food. And so that exposure is a deal. We can also have endotoxins. And this is something people don't think about. That's from inside out. So it can be like our gut microbiome producing toxins, or our hormones not being metabolized properly, or even anger or fear or loneliness, some of the emotions. So endoexotoxins, environmental toxic load, that's the big picture. Mold is in this, and this is a big one because a lot of times it's very insidious in our environment. And the thing about that I wanted to say that is related to all of your listeners with the autoimmune emphasis that you've always had is the three things that happen with environmental toxic load when your bucket is too full with toxic load and it starts to spill over the top. Cancer, which again, I'm a poster child, 25 years old, breast cancer, toxic load was involved, like some of the agrochemicals and the pesticides and herbicides were endocrine disruptors on the farm. And there's no doubt that was part of my toxic load. Number two, autoimmune. So this is the bucket that, again, many people are feeling and knowing on your podcast here. And the third is neurodegenerative diseases you mentioned, and that could be MS as well, which is autoimmune, and neurodegenerative, Parkinson's, ALS, even seizure disorders. So those three things come to the top as far as what occurs with environmental toxic load, and mold is no different. So that's one thing. If you have a new diagnosis of a neurodegenerative disease, Dr. Del Bredesen teaches some of the best work on Alzheimer's with his RECODE program. And he has now been said, years ago, he said 1 in 3 young people with Alzheimer's is mold or environmentally related. He's now saying it's probably more like 1 in 2. Like 50% of 50s and 60s, these younger people with Alzheimer's dementia are mold related. So we talk a lot about that. And then, like I said, the autoimmune is a big one, and the neurodegenerative diseases. So that's the framework. Now, the next thing you talked about is like symptoms that people might experience. So how would you know? Well, what I do is, first of all, if we talk about testing and all this, some of this can be costly, and that can be very scary if you're listening, like, oh no, what if I find out there's a problem? Or even just having an inspector come. So let me tell you a few things that are free. First of all, a really good history, which if Palmer, you or I are talking to a client, we can walk them through that. But even if you're just listening and you say, okay, when did I last feel good? And it was, 2008. And then what happened after that? And you might realize that there was a move or there was a change in your environment. You moved homes, or you maybe did a remodel of your house, or maybe there's something in there that might have shifted. And for you, you can just write a timeline. Most of my best diagnosis is actually just listening to the patient, taking a great history and asking questions about a timeline of when did they last feel well and what changed in that meantime. And it could have been a loss of a loved one or a stressor along with a move. But if there's ever an environmental change and then it also affects more than one person. Now, as you and I talked about earlier too, some of this can be genetic where there's a household and 2 people are really affected by the mold and the other 2 don't even notice. And that's normal. That doesn't mean there's not an issue for those who are sensitive, but this is an issue with genetics and your own immune system. And some of us have a more reactive immune system and can't clear those toxins. So we're the canaries that actually have the effects of the mold, whereas someone else might be like, I can't even tell in the same environment. So the history of when you last felt well, what changed in that interim, and then also, is there anyone else affected in that same environment? And frequently there's like the mother might have new diagnosis of lupus and the daughter has new onset asthma, and the father might have some allergies and sinus issues, and they're all kind of different. Now, the other thing you ask about is, let's just talk real quickly about the parts of the immune system, the innate versus adaptive. Adaptive immune system is our allergic response. So that's what, like if you have a hay fever or you have asthma or allergies or eczema, all those atopic things, even mast cell disorders, which mold definitely can trigger as well. It might be the number one trigger of mast cell activation. Those are all the adaptive immune response that kind of has this allergic response. And we've been taught in medicine and medical school that mold can be an allergen, of course. But the other part of the immune system, the innate immune system, is what protects us from viruses and colds and parasites and even toxic chemicals. And this is where the cytokines and these other parts of our immune system start to upregulate. And again, I like the example of COVID because before COVID, no one knew what a cytokine was. And then all of a sudden it's on the news every night. So since the pandemic, we've understood more that with a virus or an illness or an insult, you can have a cytokine or immune response that actually creates more damage and more inflammation than the original offender, like a virus. Mold is very similar to where the mold can be the first thing that triggers this. And then you have this vicious cycle that happens in your innate immune system. And we can measure these. So other testing you can do is TGF beta, VEGF, MMP9, ADH osmolality, anti-gliadin antibodies, and all of these things can look at the innate immune system and say, is there innate immune insult? Could it be mold? And it's not diagnostic, but it might point that direction. So that's kind of the whole slew of the immune system. And then just symptom-wise, most common is fatigue. Second most common is brain fog. So brain fog and fatigue, which are very generic. They could be all kinds of things. But if you moved into an environment and then you maybe had a dishwasher leak and then all of a sudden you had more brain fog, those are the kind of stories that I hear that tell me. Now, the other free thing you can do is a visual contrast test. This is free online, or in an office like mine, you can come in and get it done. So there are ways where you can start to screen without. So history and visual contrast study are great ways to do screening and say, could this be an issue without spending a penny? And then, of course, you can do urine mycotoxins, you can do the blood work, you can do other types of testing and really check and see. And then I usually have people start with a qPCR in the environment. So we have the body, the human body, and that's where the urine mycotoxins, the blood work are all effective. And then we have the environment. And while everybody ideally should have a great inspector, there are so many places in the US or internationally where there's not these inspectors that really understand the difficulties and the nuances of mold inspection. And so for that reason, frequently I do recommend starting with a qPCR, which is a dust test, to kind of test a snapshot of the history of what's in your house. And what you do is you collect a dust sample according to instructions. It's usually like a Swiffer cloth. You send that in, and then the lab analyzes that for DNA of certain molds in your environment. And I can tell by looking at a glance almost always if it's an issue or not, because, for example, say you have just a little bit of aspergillus and that's it. Probably not a big deal. Maybe you need to clean. But if you have a ton of Chaetomium or a ton of Stachybotrys, these nasty black molds that shouldn't be in our dust or in our home, then I'm much more concerned. And then if that's positive, I'll say, okay, well, let's get an inspector to find out where that's at. But that can kind of save you some money if you do the dust test. See, is there an issue to my symptoms? And so I do the human test, the dust test, put that data all together and try to make a case for if there's mold or not. And then if there is, of course, you need a good inspector and a good remediator to fix the problem.
Beautiful. And we will dive deeper into this because details are super important when it comes to mold and healing from mold. There are a few other symptoms I want to run by you that we frequently see. And I wonder if you have, I'm sure you have experience with this, but sinus infections, even cognitive impairment, maybe insomnia if somebody is not sleeping well in their own home, or maybe when they sleep someplace else, they feel better, or you sleep better when you're elsewhere, or you go camping because you're out of that environment, right? That's another clue that we see. You mentioned histamine reactions and rashes. I mean, all of these mysterious symptoms can come from so many different things, and headaches. We see
Yes.
headaches and frequent urination at night. Are those things that are clues for mold, or maybe many other things too?
Yes, 100%. You just named some of the really big ones. And it's interesting because a lot of the ones you mentioned are related to histamine. So back to mast cell activation, that's a whole nother topic we could talk about, but it's so dovetailed with mold because mold tends to be a very big trigger of mast cell activation. So what is that? These are your primordial cells that kind of protect us from invaders, and they're called mast cells, of course. And for some people, there can be a trigger. It can be heat, cold, hormones, it can be chemicals, it can be mold that triggers those mast cells to be a little bit more aggressive and activated. And then they throw out things like prostaglandins, which can increase your pain, histamine, which can increase migraine headaches or pain symptoms or itching or rashes or a lot of the things, even brain fog. So some of those mast cell things can affect even heart rate or anxiety or insomnia. So a lot of times it's partially due to the mast cell activation that creates the symptoms that lead to mold. And mast cell activation is a whole nother topic that we can talk about, but the key is there. If the root cause is mold, you have to treat the mold in order to get the mast cells under control.
Absolutely. Oh, it's always a conundrum. And one thing that I find when people say my environment is super clean, I'm not being currently exposed to mold, and maybe we'll do the Ermine test that you talked about. But do you find that sometimes it can be a historical situation where maybe they had a moldy dorm, or they grew up and maybe the bottom floor and they lived by the bedroom room was right by the basement, or there was water damage when they were growing up? It's hard for people to imagine that mycotoxins can actually accumulate in your body. It's not something that we just, pee right out. It's something that might stay in our lungs or the cavities of our body, like our sinuses. Is that something that you see?
Yeah, so we can have exposure and then we excrete it, or we have exposure and have, so say we have, say 10 years ago, I had a moldy apartment and I got mold exposure, and that mycotoxins from the mold, like the smoke from the fire, accumulated in my tissues. I could still be having some issues if I'm not good at detoxifying, and I could still test positive in the urine even though I'm not currently exposed. Now, we don't know what length of time. So, for example, is it, if you have a positive urine mycotoxins, is that 1 year ago? Is it 2? Is it 10? We don't really know. Usually, if there's some in the urine, there's a pretty recent exposure, meaning a year or two, not 10 years. But you can hold toxins in your tissues. And like I described with the lungs, if you think about it, you inhale, alveoli have no protective barrier for that smaller particulate that goes right into the bloodstream. Bloodstream then distributes it to your fat tissues. And so you hold lots of toxins in your fat tissues. One of the little caveat here is, with all the weight loss and the GLP-1 agonists and things, a lot of people who are really toxic go on a weight loss program and they lose, 20, 30, 40 pounds, and they feel worse instead of better. And that's usually a sign, because they're diluting their effect of the toxic load when they have extra weight. Body does that to protect them. And then when they lose the weight, they have less to distribute that toxic load. So I always do toxin removal and detox before weight loss if possible. And again, side note, but important to talk about. But these accumulation tissues. And the other thing you mentioned is colonization. That's a little different. And not everybody with mold exposure has colonization. Colonization is where you actually could inhale spores, not the toxins, sinuses, lungs, gut, really anywhere in the body, but it's real common in the mucosal cavity. So in your sinus cavity, in your lungs, or in your gut. And we can actually measure certain things in the urine on an organic acid test. This is a little tricky to diagnose. So sometimes you have to have a high index of suspicion. But I would say many of the patients who get stuck and aren't getting better, I will treat colonization in the sinuses with sinus sprays that are anti-mold, antifungals, and they'll get better. So I think there's a lot of percentage of people that do have some colonization. Lungs are less common, although I have a half a dozen cases that had aspergillomas, which is like a ball of fungus in the lungs. In fact, I have a very good friend that was a father and teacher in functional medicine, not physical father, but a father of the teaching, a very good mentor. And he was first diagnosed with lung cancer, turned out to be mold in the lungs, and he was not treated appropriately. He ended up dying from that. But it was kind of really amazing to hear the story of how they thought that that was a tumor, and it actually was a ball of fungus in the lungs. And then the gut can contain mold as well. And so sometimes we're doing gut protocols to get rid of yeast or mold in the gut.
If we listen to you and your incredible fountain of knowledge here, from your personal experience as well as your clinical experience, I am realizing how important it is for people to work with a doctor who is trained in complex chronic illness. Because this is just not something that you can throw darts at or do a quick detox. I mean, it's something that just, you know, is beautiful, your level of knowledge and experience in treating this. So thank you for sharing all of this. And anytime you want to add anything, I really hope you dive in with it. So let's go back to the testing, because let's say that somebody resonates with this and like, I mean, God, I've been having headaches and
Yeah.
insomnia, and I've got all these histamine reactions, and I'm suspicious I did have a lot of leaks or a basement flooded. Maybe I should do something about this. Do you recommend the ERMI test as the first test that somebody run, that the dust test that you talked about? Is that something that they do certainly before you have somebody come out and do an inspection?
So this is such a great question. It's very controversial, even in like the groups, like the nonprofit group I'm part of, it's the mold doctors, but I will tell you this. I'm always thinking about financially that all this costs money, right? An inspection could be anywhere from, maybe at the very little, 500 is a and often it's 1,500 with testing, or 2,000 or more. So, and that's just to find out what the problem is, not to do the remediation. So it can be kind of cost prohibitive. So just because of that, and because in the clinic, when I see that, and let me clarify, ERMI is the old name for a qPCR. ERMI is, you can still get an ERMI if you Google online and find places, mycometrics.com and Envirobiotics and the dust test are the top three that I use. They all do ERMI tests, but I like to call it qPCR because qPCR is actually what the technology is, which is qualitative PCR, polymerase chain reaction, which is checking for DNA of mold in that dust. ERMI is how they put that data together. And that was actually a HUD housing. And they took half the houses that they thought had mold and half that didn't have mold. And they said, okay, let's make a logarithmic scale about the moldy houses versus the non-moldy houses. Well, it turned out some of the non-moldy houses also had mold. So that data isn't very accurate. And I don't use that ERMI score. So I avoid particularly using that name just so it's not confusing, because a really good mold inspector will say, oh, ERMI's invalidated. And they're right, right? But it's the technology of the test, which is qPCR, that's totally fine and really good data. So I just say that's a great way to start. It's affordable. Most tests are anywhere from 300 to 350, somewhere in that range, for a sample. And you can do your whole house. Now, if you want to know upstairs versus downstairs versus basement, by all means, you could do 3 samples and then you know where the problem might lie. So if someone has the money to do a couple in their house, that's a great way to do it, but you don't have to. And it's just a snapshot of what has accumulated in the dust. So number one, if you have a very dusty home that hasn't been cleaned, you might have a false elevation, because sometimes the only thing you need to do is clean your house and the numbers will improve. It's not always a mold issue. It's sometimes a dust issue. But number two, say you cleaned a week or 2 weeks ago, which is usually what I recommend before you test, give it a week or two after your last cleaning, and you still have a lot of mold issues. Well, then, like you said, the next step would be go to an inspector, which can cost a lot more money, but you have to find the source. So you might have a beautiful test of the dust and you find Stachybotrys and you're like, okay, here's the issue. And I go a step further because I'm testing patients' urine as well, right? So when I see their qPCR in their urine, I like to match and say, does this fit? Is this the type of mold in the environment that they're showing up in the urine? Because I kind of want to see, is this likely the source? Because it could be their workplace, it could be their car, it could be something else other than their home. Now, I will say those don't always match. And you could have 4 people, same house, different excretions of the toxin. So you can't expect that everybody in the family is going to have the same test. It doesn't work that way. But I like to have a little data to say, likely this is from your house. But I think that's a great way to prioritize, is like test yourself, test your house with qPCR, and then get an inspector. And you really want to find someone, we call them indoor professional air professionals, so IEPs, indoor environmental professionals, that have the understanding of how this affects the human body, because they're much more likely to really go deep and help you find the answers that you need.
I love it. I love it. And I'm going to link to all of this in the show notes so that people can have access to resources and where to find things. I would be remiss if I didn't ask you about the qPCR test that you go to. What do you recommend? And can people order it on their own, or do they need to go to a doctor for this particular test?
Yeah, I know they can order on their own. I like it's just called the dust test.
The
Um,
dust test.
Yeah, they've done a really good job, and all of those companies do a great job of information. So the other two, Mycometrics and Envirobiotics, do a great one. The dust test gives you kind of another level of information, and they can not only do the mold spore species, but also mycotoxins, which you talked about as well. So it's kind of nice to look at both of those if you can.
Got it. Got it. And then as far as testing the human body, I know that there is a wealth of tests on the market and people can do different things. And this is where I think it's really important to work with a practitioner who can order these and interpret these. Is that how you would say that? And
Yeah, and there's 3 big companies that do it: Real Time Labs and Mosaic, formerly so I'm blanking on their former name. Mosaic Labs is what they're called now, and Vibrant America. Those are the 3 that do it. They all have completely different technologies. So sensitivity, specificity, I could do a whole lecture on that. So some of them are less sensitive, but more likely real results. Some are super sensitive and may get some false positives. And you kind of have to talk to your doctor about that, because it's a huge difference. You can't compare test to test from different companies either.
was it Great Plains?
Yeah, thank you. Yeah,
Okay.
the old, yeah, I was
I
like,
thought that came to
yeah.
mind. Okay, that's John Mosaic. Got it. Um, is there, can you talk about the marker called MCA, methylphenolic acid? Because my understanding, and forgive me because I know a little bit of information and it may not be diagnostics for sure, but I'm learning so much in collaborating with the naturopath that I work with who specializes in this. And my understanding is that it's something that actually should be excreted every 24 hours. So that if your MPA levels is low, that might be an indication that your environment is not currently dealing with a lot of mold. Or maybe you just have excellent detox pathways. I don't know. But is that something that you look at to see, to tell whether somebody's currently living in a moldy environment?
So yeah, and it's so interesting because I wanted to mention this earlier with immune suppression. Mycophenolic acid is one of the mycotoxins. So that's the smoke from the fire, from the mold, right? And what's interesting too, I didn't mention earlier, but you can have aflatoxin, ochratoxin, mycophenolic acid, trichosathenes, and different molds can excrete the same mycotoxin. So it's not like a one-to-one where you know this toxin's always from this mold. And
Mm.
mycophenolic acid can be from various molds like aspergillus or penicillin or other molds. It is powerfully immune suppressive. And this is where I wanted to go earlier. We actually in medicine use it to create a drug called CellCept. CellCept is a drug given to organ transplant recipients to protect them from rejecting that organ. So it's one of the most immunosuppressive things, and it's used as a drug for severe immunosuppression for organ transplant. And they use the mycotoxin, mycophenolic acid. It's just named CellCept as a drug. So we know this is immunosuppressive, and that's one if I happen to see on the lab, I'm like, oh, with this, we're dealing with an immune suppressive issue here, and often they'll have frequent infections. And back to your point, I think I'm not sure about the circadian rhythm of our own excretion, but I do know that's one of the things about the um, lack of fidelity for urinary mycotoxin testing. It can vary day to day. It can vary based on your diet. So it is not an end all be all. And the thing that makes me most frustrated is online or in social media when people are like, oh, I got a positive urine mycotoxins. That's the only thing they've done. And they're like, I know I have mold exposure. They might, but just a positive urine mycotoxins alone does not indicate a for sure mold exposure. There's so many other explanations, and you need to really either work with a practitioner or know what you're doing so you don't overdiagnose this either. But back to excretion, one of the things really interesting, not exactly the question you asked, but very fascinating. They took like hurricane damage, water damaged buildings, and they did like time intervals sampling of the air with different molds, and they had a massive change in rhythm. I can't tell you like certain time of day that was always the same, but say from 8 a.m. to 8 p.m., there was a massive difference in the amount of mycotoxins in the air. So we saw that even in mold colonies, there's a difference, a rhythm of how they excrete their toxins. So there's so many variables here that it's just not a black and white situation.
Not
Now,
at all.
having said that, someone like me who does mold all day long, and I love helping people heal from mold, I will say, and my staff jokes about this, I think 100% of the time when I thought there's a mold situation, I've been right. And this is not to toot my own horn or be egoic, but the truth is like if you're a good diagnostician and you take a good history, and if you're a patient, you just want to know and you can do this very well without a lot of expensive testing.
I love that. And I love how mindful you are about people. And here's one other really innovative resource that I wonder if you know much about, and that's mold dogs
Yes,
as
yes,
inspectors. I'm
yes.
super excited about this because a mold dog, if people have heard of bomb sniffing dogs. Well,
Uh-huh.
there's actually a gentleman in Florida who has a canine academy who now trains mold sniffing dogs. And you just go to mold-dog.com and you can learn about him, Bill Lipstein. I think there might be something like 30 or 35 trained mold dogs in the country. And what I really love about this idea, and we have to quiet this and use services, they're not biased. They're not going to charge you for
Right.
all kinds of tests. The dog is literally going to go right to the place where the mold is. And even where a nose inspector may have missed something, like a
Yes.
client that had a mold problem in the chimney. And the mold inspector had not found this, but the dog goes straight over the chimney and sits down. And that's what the dog was trained to do. And then we know you're the problem.
Yeah. We have one in Fort Collins near us, and I haven't used them myself, but I have several patients who were just like, Jill, you would not believe how good they were. Like, so I have to get in touch with them and just maybe just meet them. But I totally agree with you. It's a really great way. And I think maybe the future, right?
Yeah, absolutely, absolutely. So let's jump to what do you do? So
Yeah.
now you've figured out that you've got a problem, and where do you start? And you can just take this as high a level as you want to, because I know it's huge and we don't want your whole treatment protocol, because everybody's different. But how do you think about treating people when it comes to, yes, you've figured out they've got elevated mycotoxins, maybe to a toxin, and they're
Yeah.
dealing with autoimmunity. What do they do?
Okay, so it's really easy to think of a framework as we need to mobilize this. So if it got into your lungs, into your blood, or whatever exposure way that you got it, into your mucous membranes, into your tissues, you have to go backwards and think of it this way. I always think of you have to mobilize the toxins out of the tissues into, so your liver, your kidney, your skin, your sweat, your all of those places that are normal filters, your lymphatics will filter and get rid of and excrete it. So we have mobilization and excretion. And when you think about that, it frames a lot of the issues or problems that people have. Mobilization is pretty easy. You either upregulate glutathione naturally by giving precursors like N-acetylcysteine, alpha lipoic acid, selenium, vitamin C, glycine, glutamine. All these things are contributing to production of glutathione. And then you use that glutathione to mobilize phase one and phase two of the liver. So you're taking the toxins out of the blood, putting them into water soluble form and excreting that into the bile. And then the bile gets dumped into the small bowel, into the large bowel. And typically, our body recirculates pretty efficiently. About 95% gets reabsorbed, but we can interrupt that with certain binders like clay or charcoal or glycomannan or chlorella or cholestyramine or Welchol or any of these things that have been used, because what they are is they have a static charge and it will tend to attract heavy metals or mycotoxins or even bile. Some of these are bile acid binders, and that's because bile will store these things and then it'll pull it out through the stool. Your urine and your kidneys can also do some excretion, but mobilization is upregulating that glutathione in whatever way. And you can give glutathione, IV, nebulized, liposomal as well. Some people, though, will oxidize. They're in such an oxidative stress environment with reactive oxygen that you give them glutathione. They oxidize it, which makes it not effective and actually more toxic if it's not reduced. And so they get into trouble. They don't tolerate glutathione. And I'm just saying that because some people are like, oh, what am I going to do? I can't tolerate glutathione. For my first 2 years of detox, I couldn't either, and I did just fine. So you don't have to take glutathione, even though it can be helpful to get well. So if you're afraid of your reactions are not doing well, there's other ways. But that whole glutathione mobilization is number one. Now, I mentioned the excretion because if you upregulate mobilization quicker than you can excrete, you get sicker. You don't feel well. For example, I started taking massive binders and detox when I first knew I had the exposure. I had hives from head to toe for like 2 months, and I was going way too fast. I was mobilizing more quickly than I could excrete. If I would go back to that younger version of myself, I'd say, slow down, take it easy. And with patients too, I check in because if you mobilize too quickly and you're not excreting, you get sicker, you're toxic, your bowels stop up. There's all kinds of things. And so you want to make sure bowels are moving because that's one huge route. You want to make sure you're upregulating glutathione or taking glutathione. You want to support the liver, things like milk thistle or bitters. You want to support the bile flow and you want to support any sort of binders that are doing their job of pulling that out. That's the basics. And then there's a lot of things with excretion you can do, like infrared sauna. You can do coffee enemas. You can do castor oil packs. You can do something I do every single night, and that's Epsom salt baths. You can do lymphatic drainage, massage techniques. You can do rebounding. You could do vibrational plate. All those things help lymphatics. And all of this together gives you kind of a protocol. Now, a lot of people say, how long does it take? My experience is it's usually 6 months up to 18 months to really detoxify. And you might start feeling better after 6 months, but you're not probably going to start feeling a lot better in a week. It takes a lot of time.
You just absolutely nailed so many of the questions I have. You just gave that in such a beautiful one fell swoop. So that's fantastic. And then what are some helpful things that people can do to keep their environment clean, their air quality? I want to ask you about both air filters and negative ion generators. Life. Have you heard of HypoAir? Have you ever used that
Yeah.
as a negative ion generator? And then cleaning solution. So what can people do to now keep their environment clean or prevent mold from becoming a problem?
Oh, see, I love doing these interviews because you go to this is so important, guys. This might be the most important thing you do because maybe you don't have an issue, but literally the prevention will keep you from having to go down this pathway like I did. So first thing is I like to keep it simple. And I always say something that'll hopefully stick with your listeners: clean air, clean water, clean food. Start with the basics because prevention is so much worth 1,000 pound of cure. So clean air, you want to make sure your air is filtered in your house. You can't assume anymore that it's clean. Unfortunately, 80% of our environmental toxic load is from the air that we breathe. So I recommend getting a standalone filter. I like the IQ Air and the Austin Air and the Air Doctor. I have Austin Air, but those three are all really good. What you want is you want a great HEPA filtration system with a VOC filter as well. That usually means the core has zeolite or charcoal that will actually pull out some of the particulate, the volatile organic compounds that are really tiny, the mycotoxins and things. So I always want not just a HEPA filter, but a VOC filter as well. In my condo, I have 3, and at my office, I have 5. So I have lots of air filters.
You are covered.
Yeah, I'm totally covered. Now, in your furnace or your HVAC system, you can put in a filter there too. You can buy the highest MER rating that you can get for whatever diameter of filter that you can put in there. Sometimes you can only get a 13 or a 16. Get the highest quality filter that you can, put a note on your iPhone to change it every 3 months. And you might pay a little more for utilities because of the thickness of the filter, but it's so worth it. And then make sure you're changing that routinely because you don't want that dirty filter to be in there for 6 or 12 or more months. That's clean air, clean water, making sure you drink filtered water, not out of plastic water bottles. And RO is super clean, but that is also a little bit more acidic. So you can also just do a pitcher in your fridge or on your countertop. And then clean food, trying to avoid the highest contaminated mycotoxins foods, and then even glyphosate and chemicals and pesticides. So mostly organic, local, sustainable kinds of foods. Now, other things you can do to prevent. So I have spray bottles of diluted Clorox. Now, you don't want to remediate with Clorox. It's a very bad idea. But if you want to just keep your showers clean, I use a very diluted water solution that I just spray down the shower, not even every day, maybe every week, just a little bit around the tiles, around that, so that we don't have any growth. You can use botanical products as well. And I have done that before. Some of my favorites, E3C, and there's a clove product, and there's BioBalance out there that's a citrus product, citrus-based stuff. All those are great. And I've used all those as well. I actually clean out my drains every 3 months. All of my sinks, I pour down some solution, make sure those are clean. Your garbage disposal is a big one. All of your sinks, you want to make sure you can buy very cheaply at Home Depot these plastic mats that go under your sink, and they have a sensor so that if you ever get a water leak, you are notified immediately and there's never damage, because so many of water leaks under sinks go undetected and create mold. And it's such a simple thing to fix. Around your bathroom, say you have kids, they splash water out of the tub. A lot of times that caulking outside of the tub is not waterproof. So you can very easily put PVCs with silicone on the edging around your tile so that you don't have anything that can get into the floor or under the floor, and especially by your bathtub. You might as well just do it. And for my shower, what I'll do is like around all the, especially the bottom pan, I'll put silicone. I'll just put that on there so it's waterproofed, because people think that grout is waterproof. It's not always waterproof. So you either need to regularly seal it or you need to make it waterproof. Those are some of the big ones. Washer, dryer, making sure you check the connections and there's no leaks. Fridge is a huge one. A couple years ago, I had my neighbor's fridge leak because his water line was not connected into my floor and into my condo, and had massive mold. I don't connect my water line to my fridge anymore because it's just not worth the ice. I make my own ice in trays the old-fashioned way because I don't want to have that risk of a water filter. Many people, ice makers, fridges can leak. Attics and crawl spaces, making sure they're sealed and they're properly maintained. If there's not too much or too little insulation, there's no condensation. And then also just making sure that you have no condensation on your windows or things like that.
This is so beautiful. What a wealth of information you are. And I just love listening to you. I could listen to you all day. This has been magnificent. And I was actually going to end by asking you about what you do to keep yourself well. And it sounds like you've already listed so many of the things that you do to live a detox lifestyle. I know that you've got clean air, clean water, clean food. You're probably doing all of the things from an exercise perspective and mindfulness and saunas, but I don't want to put words in your mouth. If I've missed anything that you would love to add, I would love to know. You have gone through so many things yourself. Are there other things that you're doing to live this prevention path and not be taken down by the environment and none of the user dogs?
Thank you, Palmer. So all the stuff I talked about, I super clean. I have clean air, clean water, clean food. I practice that. Energetics, I think, are the next level. So I use red light. I use PEMF. I really enjoy those kinds of therapies for skin and for energy and for body. I think the most profound, though, is on the spiritual level. I have a deep faith in a higher power and a greater purpose. And that is like my most sustaining factor, is this deep sense of meaning and purpose. And then the connections with those that I love. And like, we've talked before about life and craziness. And I feel like the last year, my biggest change and transformation has been, how do I limit my, maybe it's travel or things that take away energy, and really focus on those people and things that I love, and making sure that I maintain, because so often we can get productivity kind of in that wheel, the hamster wheel, and feel like we must be more productive, and we neglect relationships and connections. And I would say for me, it's just more we're fostering the faith and connections, because those I feel like are such powerful healers.
Could not have said it better. And with that, I think this is a beautiful place to pause. We will have to have you back because you are an amazing resource and wealth of information. And it's just such a pleasure. And one of the things, as I said, that I love most about you is that you combine science and spirituality so beautifully. And it's just natural. I mean, it's both and.
It is.
It is just so, so, so lovely. And I really appreciate you, Dr. Jill. Thank you for coming and sharing the wealth of your knowledge and wisdom.
You're welcome. It's always such a pleasure.
I look forward to the next time it's done. Thank you.
You're welcome.
And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.